Everyone, it's DL Walker here, and I'm hurt. So I'm a professional, and I wanted to share with a lot of people what I do when I'm in pain or something happens to my body. And I think this is really appropriate because a bunch of people in my life have recently come to me with some acute flare-ups of injuries. So for me, I tweaked my hip a little while ago. I suspect that it might be a cartilage tear, and it's pretty painful. So I did what most people do and ignore it and try to continue using it and doing my exercises. Well, guess what? My body said no. So here's what I should have done right away. And if you're having an acute problem, here's what you should do right away. The first thing is anti-inflammatory. So when you're getting that sharp acute pain, it's your body's way of reacting to inflammation. Now, inflammation is that I'm not a pill taker. I don't like to take pills. There are a lot of options out there for anti-inflammation, including diet, including topicals, including modalities. Figure out what you want to do. As a matter of fact, I have an appointment for acupuncture in about 10 or 15 minutes, which I will use for anti-inflammatory purposes. The reason why inflammation is a bad thing: for every cubic centimeter of inflammation, a muscle shuts down by 1%. The muscles that are closest to the joints that are inflamed are your stabilizing muscles that protect the joint and allow the moving muscles to move. So if you don't address the inflammation like ASAP, those muscles are going to shut down and they're not going to protect the joint. The joint is going to become more damaged, more irritated, more inflamed. The sooner you can address an anti-inflammatory or implement an anti-inflammatory, do it. The second thing is an assistive device. So if your problem is in your lower extremity, like mine is my hip, or if it were my knee or my foot, I want to implement a assistive device if I'm limping, because limping will change my gait pattern, which is going to cause more problems down the road and in future. So the second thing that you're going to want to do is implement an assistive device so that you can maintain a normal quality gait on both sides, as well as alert other people that you're having a problem so they stay away from you and you're not having to react quickly, which again, those quick movements that are protected by our core muscles are now affected by the inflammation. And when they can't work right, then we're going to get that stitch of pain. If you are having pain and the anti-inflammatory is not doing it, then take an analgesic. An analgesic is something for pain, but only in addition to some sort of anti-inflammatory. Again, analgesics can be something like ice, as simple as that. And I don't recommend, again, taking pain pills per se. Certainly not something strong, but topical analgesics will tend to trick the brain into thinking that there is no pain, because what will happen, the longer that you are experiencing pain, it messes with your nervous system in the brain, where you become more sensitive to pain. So we don't want to become chronic pain. So those are my 3 recommendations right from the start: anti-inflammatory, analgesic, and assistive device if needed. Tomorrow, I'm going to get into some other things that you can do right away, but I want to keep this short. And the other things are going to require some demonstration. So I just wanted to get on. If anybody is going through this kind of thing, definitely address that. I will say the other thing to look at is for restricted muscles in the area, not at the location of pain, but around it. And if you're a member of my programs, you will know the comprehensive core release technique, which I advocate doing to relax those other muscles around. So if you're a member of my programs, great, go on your membership page, look at your area of dysfunction, look at the places to address with release. And if you're not, consider joining for a 7-day free trial. The information is in the information box below, and I will go ahead and come on in the next few days and guide you through the rest of what I do when I sustain an injury or have a acute episode of pain. So have a great rest of your day, and I'll see you on the next video.